Hi, thank you for joining us today at Marculaitis Pulmonary Practice. Today we are going to be talking about pleural effusion. Pleural effusion is a buildup of excess fluid within the pleural cavity that surrounds the lungs. Some causes of pleural effusion are congestive heart failure, poor liver function, cirrhosis, pneumonia, renal failure, and the most common cause is lung and breast cancer. Some indications that show that you may have a pleural effusion are shortness of breath, dry cough, trouble breathing, and chest pain. If any of these symptoms occur, you should come visit our office at Marculaitis Pulmonary Practice, and we can do some tests to verify if you do or not. We can do a CT scan, a chest ultrasound, or a chest x-ray, and if any of these tests come back positive, then we will start towards the procedure process immediately. The most common procedure for a pleural effusion is a thoracentesis. This is a minimal invasive procedure that involves a small needle going through the back intercostally to remove fluid or air. Patients that have a recurring pleural effusion may have a pleurodesis or a peritoneal shunt. This problem is so important to take care of as soon as possible because if not, fluid may turn into empyema, which is an infection of the fluid that is turned into a pus-like fluid. This leads to scar tissue in the lungs, which makes the fluid harder to drain out later. And then from there, it turns into an infection and makes its way into the red blood cells, into your circulatory system, which could become septic. For my project, I created the thoracic cavity. The thoracic cavity contains 12 pairs of ribs, the lungs, diaphragm, heart, aorta, and IVC. My lungs. And technical difficulties. My heart. Okay. This here represents my pleural effusion. These are the lungs within the pleural cavity and the diaphragm here. The pleural effusion is this fluid here. It is in both of the lungs for my project. And with my diaphragm here, it shows the contraction of the diaphragm when you breathe in and your lungs expand. If you can see that at all. And that's my project. Thank you for watching my video, and I hope you got to learn something a little more about pleural effusion today. Thank you for coming and having our day with us at Marculaitis Pulmonary Practice. And if you have any questions, you can contact us at 1-800-EFF-USION. That is 1-800-EFF-USION. 1-800-EFFUSION. Some indications that you may have a pleural effusion are shortness of breath, trouble breathing, dry cough, and something else. Chest pain. The most common procedure what the hell are you doing? The most common procedure for a thoracentesis is a thoracentesis.